just to go over a few things. If you're not aware of the activities room, there's a bathroom right here in the back there you can use. There's also one down at the end of the hall. Feel free to just jump up whenever you need to. It's not an extremely exciting day, so when you need to stand, stand. I do ask that you keep your masks on during the trainings. However, if you're eating or drinking, obviously you can take them down, especially when you're congregating. So after, you guys are pretty much sitting 6 feet apart, but when you get up and move around and stuff, make sure your masks are on, please. Let's see. We are going to be following your schedule here. So you have 3 things that you picked up in the back. One of them is paperclip or stapled together. This is pretty much your Bible for turning in by the end of the day. So the first page is the agenda. So we'll be doing everything on this agenda. I'm not going to guarantee you we're going to do it in the same order. It just depends on people's schedules, but pretty close to it anyway. And you will also notice, just as far as masks, so we make sure that everyone can hear us. The presenters aren't going to have masks on, and we're also recording it today so that we can have it for people who may be on leave of absences and stuff to play. So just remember that we won't have our masks on. The next page and a half is annual competencies. If you were here last year, we started this. So Department of Health wants to know that we were trained, so your signature on that sheet says you were trained, but they also want to know that you know what you're talking about, so that's what this form is. I ask that you not go ahead, just stay within the training. So when I get started, I'm going to be doing policies and procedures, so kind of go with that, answer questions and stuff. Then you have a staff self-evaluation of infection control practices. Karen will go over that a little bit later, but basically you're just going to be check marking everything on this. The next one's pictograms. Steve will be doing that later on with you. On the back of that is an N95 user seal check. So again, Karen will go over that when she's doing her section, but she's just going to kind of go through basics as far as if you're wearing an N95, ways that you can kind of check to make sure that it is fit pretty good there. The next one is your employee tuberculosis assessment. So the assessment is done in lieu of a shot today, and I know everyone's really upset about that, but we are, again, last year we were in a shortage, we were in a real shortage. We were having trouble getting it for new staff and residents. It has come back some, but we are still considered in a shortage. So because we're in a shortage, we don't actually have to provide the TB test, we just have to do the assessment. So you're just going to go through there and answer. On the back of that one is only licensed staff, and the 3 licensed staff in here already did that section right there. So no one else has to do that, where it says skills checklist for LPNs, RNs, TB testing. And lastly is the flu vaccination form. Unfortunately, we do not have the vaccine yet. It has not come in, so we won't be doing vaccines today for flu. I will also let you know, and don't quote me on all of this, but with COVID going on, it is very important to get your flu shot. I know there's people that never get flu shots, and I probably won't change your mind. But if you get the flu shot, you're going to have more protection against you this winter when we're having some more issues with flu and all that kind of stuff. Our medical or our infection control doctor, Dr. Tirapathy, was on our infection control meeting yesterday, and he is strongly encouraging it, and therefore we are as well. I will also tell you that more than likely next year you will not have a choice. It probably will be mandated either by us or the state. The rumor is the state may even mandate it at that point. But I just want you to go through that and think about it. Again, I know there are some people that can't get it, that are allergic to things and all that kind of stuff. And we have not figured out the details of everything, but I do highly encourage you get it when it comes around. Okay? Any questions about all this stuff? And your 2 loose leaves we'll go over when one of them's the flu or just the information on the flu, and the other one's about the N95. And again, Karen will talk about that when she's talking about N95 stuff. And I'll apologize ahead of time. I take a certain medication that dries me out so quickly, so I take lots of drinks. So we're going to start out with policies and procedures. So in my sections, I will have policy and procedures, I will have HIPAA, and I will have corporate compliance. So I'm going to do all 3 of those today without trying to trip, hopefully. And I'm going to start out with the policies and procedures. All right, our first one is progressive discipline. Progressive discipline is a policy basically to ensure that we are doing the same thing for each employee, that we are not deviating and just saying we don't like you so you're getting a suspension. It's really there to guide us on our disciplines. Normally you have a verbal, written suspension and a termination. Now I will tell you there are occasions that we skip steps depending on the severity of the issue. Sometimes there may be a care issue that we believe is way past a verbal but not quite a termination. So we can skip them if we need to, but we would give you justification on why that was done. Also like to point out that if you're going through your progressive discipline process here, which means you've already gotten your verbal, you've gotten your written, maybe you've already gotten your suspension, and next step is termination. If you turn your act around and go 6 months without any type of disciplines, that goes straight back to verbal, okay? So there is hope at the end of the tunnel there. Also, we do our disciplines based on categories. We don't have a point system like some places do. And when we go by categories, I gotta say it's extremely generous to you guys that we do that, because if you're having attendance issues and late issues, we count them separately, okay? And we count care issues separately. So just because you had a verbal already for attendance and now you need a write-up for tardies, we're not going to go to a written, we're going to go to the verbal, okay? Speaking of attendance, a few things, call-offs. Call-offs have to be 3 hours or it's considered a late call-off. You cannot leave messages. I can't stress this enough. If you call and leave me a message saying that you're not going to be in today, it is considered a no-call, no-show. Number one, I don't get your call-offs, but if I'm not here, I'm not going to get that message. So you have to talk to someone. You cannot leave a message. You have to call off for each additional day, unless you have a doctor's note saying that so-and-so is supposed to be off 3 days in a row, then we obviously know that. And for at least 3 days in a row, you do need a doctor's note to return. And that's more protection for you and for us. And I'm not going to lie, some of it's a liability for us. If you come back after 4 days of being sick or a pulled muscle or whatever and come back without a doctor's note saying you're ready to come back, you could re-injure or be sick here and it can turn into a liability situation. All right, so how you get disciplines is if you have 3 or more occurrences in a 90-day period. Again, we do track the absences and the tardies separate, but the rule was the same. If you have 3 or more occurrences in a 90-day period, you'd receive a discipline. Tardies are considered 1 minute late. We're a nursing home, we're not McDonald's. We have to take care of residents, we have to do things to take care of residents, therefore you need to be here on time. Call-offs for any reason, including weather, if you're an essential personnel, are considered call-offs. If you do have a doctor's note, we'll repeat a discipline. So if you haven't been in that process yet, so say I've already gotten a written warning for attendance. The next time I call off, I go to the doctor gives me a doctor's note saying I can return back to work, but I need to be off for that day. If I'm due for another discipline, we will repeat that verbal, and we do that 1 time for each step. And call-offs for the weekends are considered Friday, Saturday, Sunday. If you call off on a weekend, you can be put on the schedule 60 days after that call-off, up to 60 days after that call-off on any shift. Dress policy, we don't have a whole lot of issues, so just briefly, make sure your hygiene's good. Please don't make the directors have a conversation with you saying that you don't smell the greatest. It's not a fun conversation for anyone. Be careful of smells, perfumes, deodorants and stuff. Some of those strong smells do cause issues for individuals. Fingernails, clean, trimmed, make sure they're not too long that they're going to cause skin tear issues. Hair, we don't really have issues with, but if it's long enough, it needs to be pulled back. Footwear, safe and secure, so really office staff are the only ones that should be wearing open-toed shoes. Everyone else should have closed-toed shoes on to make sure of safety. And then, of course, we have different shoes that are specific to departments. Dietary has to wear non-skid-soled shoes. Maintenance may have a situation that they need a steel toe. I don't think we have any of those issues right now, but I know when we were doing construction, we had a time that we had to do steel toe shoes. Jewelry, just making sure that it's not going to cause issues to the residents. Tattoos are allowed as long as they are appropriate. Body piercing is allowed, and badges are required to be on you anytime you're in the building. And that the reasoning for that is a regulation. Department House says the residents need to be able to identify you, and that's how they identify you, is your badges. Just all the tattoos and body piercings, like I say every year, it is allowed. Our residents do not seem to be bothered. Most of them seem to enjoy talking about things like that. But if we start to get complaints, we always have to look at this policy. Remember, we're in their home. We're not just walking around town. Inappropriate things, again, just normal things. I think we're in an eternal dress down mode right now because of everything that's going on. I can't say that I'm not enjoying wearing jeans every day. But when we are dressed down, we still have to be appropriate. Make sure your pants aren't ones that you jump from the 3rd story into to get to and sucked it in until you got it buttoned and all that. No midriff shown. You know my rules, no boobs, belly, or butt showing. If they're not showing, then you're probably pretty good. The official rule for shorts and skirts are 2 inches above the knee or fingertip rule, whichever is longer. And the reason I say that is I'm pretty tall, so fingertips are pretty high on me. So mine would be 2 inches above the knee to make sure that they're low enough. What's that? Cell phones. Again, we're in a nursing home. We're in our residence home. We should not be using cell phones while we're in here. Please do not keep them on your person. Put them in a purse, put them in your car, wherever, and use them on break times, but do not carry them around with you. With the exception of a few individuals. One is the directors, and it's not like we're making special exceptions for the directors. The directors do have the ability to transfer their calls from their office phone onto their cell phones. We have a number of them that get their emails and their schedules are on their phone as well. Maintenance, that's how we get a hold of them. They need to carry their cell phones. Transportation, obviously, because they're going to be running around and we need to be able to get a hold of them as well. Break times, if you work a 4-hour shift, you get a 15-minute break. If you work an 8-hour shift, you get a half-hour break and a 15-minute break. So if you work a 12-hour shift, you get 2 15s and a half hour. So that means if you work a 16-hour shift, you get 2 30s and 2 15s. You cannot decide, I want to take them all together at the same time and leave and go hang out at the local restaurant or whatever. You do have to take them during normal break times. And you also can't break them up, meaning if I got a 15-minute break, I can't take 5 here, 5 there, 5 there. You take it all at one time. Make sure your supervisors know where you're going. If you're working the floors, make sure your supervisors know that you have left the floor. I already talked about badges. Everyone here should have a handbook. You got a handbook when you came in with orientation with me. You are responsible for knowing that information. There is no way that I could go through every policy or anything like that in that handbook and you remember everything. So it is your responsibility to review and know the information in there. We did update the bereavement leave last year, so just as a reminder, the biggest thing that we changed was what constitutes a 3-day bereavement or a 1-day bereavement. So if it is an immediate family member, it's 3 days or 24 hours for those of you that work more than just 8 hours. And If it's an extended family, and I'll go through the definitions, it's 1 day or 8 hours. So immediate family is considered your spouses, your parents, and that would be regular parent step, in-laws, adoptive siblings, children, and grandchildren. Extended families are employees' grandparents, brothers-in-law, and sisters-in-law. Any questions about the bereavement? This does not mean you can't take time off. If you need to take time off because a grandparent died, we're not going to say you only get 1 day. You just get 1 day of bereavement leave. If you need to take additional days, you can take PTO. Reminder for our per diem staff, this is the requirements for per diem. You have to work at least 1 shift a month, work 1 weekend shift every 6 days, work at least 1 holiday, attend all the in-service trainings and staff meetings, and that's basically just so that you get your trainings in. We need to make sure that by regulation you get as many trainings in as possible, and especially with our CNAs who have to have 12 a year. They have to attend the annual in-service as well. The only exceptions to annual in-services are basically school leaves of absences and stuff. We do tell everyone if you have a full-time job at another place, we do require you to come into the annual in-service. That is one thing that we do say you have to do. Let's see, per diem. Oh, and then just more about communication. Please, if you're per diem, make sure you're communicating with your schedulers so they know what's available. If someone reaches out to you and says, can you work hours, respond back, even if it's no, I can't do it. If you've ever done a schedule, it takes forever, and then when you're waiting for one shift to be filled and no one's responding to emails or texts or whatever, it gets a little frustrating. So make sure you are responding to them. Non-discrimination policy. What our non-discrimination policy states is that any protected category we would not discriminate against. And those protected categories are race, color, national origin, age, disability, sex, religious creed, ancestry, union membership, sexual orientation, gender identity or expression, genetic information, or AIDS or HIV status. So this goes a couple ways. It goes employer to employee. It goes employee to employee. So of course one employee cannot discriminate against another employee. We also have the non-discrimination policies for our residents and our future residents and future staff. By regulation in personal care, we always have to go over new population groups. We do not have any new population groups in personal care at this point. So just in general, just keep in mind that if we have certain religions that we've never had before, we should know what goes on with that religion so that we can help accommodate them. There are religions that you aren't allowed to eat certain foods, different prayer times, those kind of things. We need to know that so we can help them with that. Of course, any ethnicity, color, race, language. We always get disabilities in here, obviously blind, deaf. And another one is age, and I say this every year. We have actually staff in here from the age of 16 to about 82. So keep in mind that's a pretty wide range of staff members. The same with our residents. We do have normally an older population, usually Medicare or older, but we do every once in a while get a younger individual. We've had some 40-year-olds in here, I know. So how you deal with a 40-year-old is not the same as how you deal with an 80-year-old. I mean, that's just common knowledge. So you have to know those residents and know your staff so that you can deal with them appropriately. More of our younger generation likes texting and social media and that kind of stuff, or maybe our older staff want a phone call. So just know that when you're dealing with individuals. I'm right there in the middle. I'm not a phone person. I can't stand calling people. If I can text or email, that's how I do it. But that's just me. I mean, it really depends on ages and the individuals. We are a tobacco-free facility, which means you are officially not allowed to smoke, use any tobacco products on company property. This is no different than when we first implemented this, FYI. Weather-related absences. Okay, so unfortunately, I swear we just were in summer last week. I think we actually weren't, didn't we? Just turn into fall.
Yes, that's the thing.
So I meant the feelings of summer, but We are going into colder weather every morning. Well, it got a little warmer, I think, this morning, but the last few mornings have been pretty chilly coming in. I love that weather. That's fall is my season, but we are coming into snow time. And I don't know whether to believe the Farmer's Almanac or not, but the Farmer's Almanac says it's going to be a hellacious winter this year. We do expect, we're a nursing home, we're not McDonald's, we can't shut down a line. We have to provide services to our residents, and we have to provide all different services. We're doing care to the residents, medications, we have to make sure that the facility's clean, especially again now we're through COVID stuff. So our essential personnel when it comes to weather are considered all of our licensed staff. Any caregivers, that would be nurse aides, personal care attendants, medication, technicians over in personal care, our maintenance staff, our dietary staff, housekeeping and laundry, and therapy, depending on what their company, since we can't necessarily say they have to be here because they're not our employees. So everyone on that list is considered essential, and that's probably almost everyone in this room. So if you are considered essential, we expect you to be here. One of the benefits of the COVID issue is that we have some open rooms here. So we do have open rooms in our quarters that we will open up to staff that they can stay in and spend the night either before or after if they'd like to. If it's a blizzard and we don't think we're going to have enough rooms, then we'll open up offices, put mats and stuff down for individuals. But you have to be here. We're a nursing home. You have to be here during those times. All right, so if you see anything electrical that looks unsafe, please report it. Don't look at it and walk away and say someone else will see it. Call one of the maintenance guys and let them know so that they can take it out of service. If Department of Health walks in and sees that, it's an automatic citation on our part. By OSHA regulation, you need to be notified that all of your medical personnel files are in my office. So if there's ever anything that you need access to, that's where it's at. You need to come to see me. Please don't just show up at my office and expect me to stop doing an orientation or whatever to get information for you. I'd much rather have you call, make an appointment, or tell me what you want. I can get it ahead of time, but I can't always drop what I'm doing to gather the information. Another OSHA thing is magnitude of energy sources. Just quickly, everyone should be familiar with what lockout tagout is. We'll go over it a little bit more here in another session, but normally lockout tagouts are just taking maybe an outlet, putting a cover over it and locking it so someone can't plug something into that outlet. Maintenance does that, other vendors do that to protect themselves if they're working on something. We have certain equipment in here that has multiple energy sources, which means it may have gas function and electrical function. And when we come to one of those, they have special lockout tagout procedures. And by regulation, they should be located right on those machines so you know what you're doing right then and there. Door codes, we stress this. The only door code that can be given out is the inside code, and that can be given to anyone but the residents of the nursing home. All other codes need to stay with our staff. Please don't get upset when the staff code changes. By policy, we have to change it every time there's a change in staff, whether it's a resignation, termination, or whatever. All right, so I know we've been a little bit different just because of COVID. I think everyone's allowed in any entrance at this point. I don't think we have them separated now. But if you are coming in from the parking lot across Queen Street, please do not come in the Queen Street entrance. You need to walk around to the side entrance and come in there. It is disturbing for residents when you continuously walk in there. You also need to be buzzed in there. There's no button or keypad to come in. So when you have to be buzzed, that means if the if the receptionists are on the phone, they can't hear that going off. Then we have to rely on our nursing staff to be at the desk to answer it. So if you could just come in the side entrance and use your code. If you ever get here and your code doesn't work, then you can buzz in and get let in. That brings me to buzzing in. You would think this would be logical information, however it is not, okay? I don't know how many times I'm going to say today, be nice. Okay, I wish I did not have to say that. Sometimes I feel like I'm talking to kids, but be nice. When we have had people, and this is, I'm not exaggerating on these comments that I will say, when we have people buzzing in and they're frustrated, they take it out on whoever answers the phone. Assume whoever answers that phone, it's their first day and they have no clue who you are. Okay, so when you buzz in, you're going to buzz and say, hi, I'm so-and-so. I'm a CNA here. My code did not work. Could you please let me in? Please and thank yous go a long way, okay? Do not say, don't hit the buzzer and say, I can't get in, let me in now. Again, not an exaggeration, people say it. So be nice when you're being buzzed in and assume they don't know who you are. Also, when you're being buzzed in, I know it gets frustrating, but you may stand out there for a little bit. And again, the reason is, if the receptionists are on the phone, they cannot buzz you in. It is physically impossible to do. So then our phones at the nurses' stations go off, but if there's no one at the nurses' station, they also cannot help you. So you may be buzzing for a little bit. Make sure nothing's in the hallways that shouldn't be. This is an easy deficiency. We are in our survey window right now, which means the state can walk in at any time. If you leave an over-the-bed table there, you leave garbage, you leave laundry, you leave a lift there, med carts, those type of things, they need to be put away. These are easy deficiencies. In the bathroom, so in the tub rooms in the nursing home, you cannot leave things in there. You can't leave used towels, you can't leave soaps, shampoos, even if they have names on them, they cannot remain in there. So please make sure you're taking everything out of the bathrooms. Questions about policies and procedures? All right, HIPAA's next. All right, the nice thing about HIPAA is there's been no changes. So I'm just going to go through this briefly so that we can get through it and keep moving. All right, so through HIPAA we're going to talk about a couple things. We're going to talk about HIPAA privacy and HIPAA security. Privacy is more of the not giving out information that we shouldn't. Security is more of the electronic things, making sure that we have passwords, usernames, and stuff on our information here. So if you ever wondered, HIPAA, number one, HIPAA is spelled with one P, not two P's. So HIPAA is HIPAA. But HIPAA is the Health Insurance Portability and Accountability Act of 1996. It is a federal law, and it is mandatory for anyone in healthcare. It protects the privacy and security of patient health information. And I will go over here in a couple of minutes what patient health information is considered. It's electronic and physical security of that information as well. And it's there to help prevent abuse, neglect, and fraud. So, who must follow HIPAA? Every one of us. So just like with the abuse and neglect being a mandated reporter, you also have to follow all the HIPAA regulations and report anything that you know has happened through HIPAA. All right, so this is past, present, and future information. So this can be, as residents go, it would be people that we're looking at admitting, our current residents, or residents who have left. It is anything that would be transmitted electronically, paper-wise, or oral, speaking. And anything that can identify the resident. Okay, so again, HIPAA, patient health information is anything that can identify a resident. What identifies residents? What would you say is a piece of patient health information?
Name.
Social security number, name. There's another very common one. What? Address is considered one. Dates of birth, email addresses, phone numbers, dates of admission, dates of discharge, diagnoses. They're all considered patient health information. So this is not an exhaustive list at all, but this is things that we are considered to use for patient health information. So a date of birth is not necessarily identifying information without maybe something else added to it, but it all is considered patient health information. If someone leaves a date of birth and just throws it away, it's probably not really a HIPAA violation because you couldn't really identify that individual just by that date of birth. But that is considered patient health information. All right, so no employee may use, disclose any individual's protected health information unless permitted by law. So what that means is we can use it for treatment of residents. So any type of treatment, maybe sending a resident out to the hospital, we can send information because that is permitted under the law. Payment of healthcare bills. So of course we can give information to insurance companies, Medicare, Medicaid. Business management operations. So when we have our quality assurance meetings or our corporate compliance meetings, we discuss certain residents and issues. That is allowed as well. Any other disclosures by law or public health or governmental reporting, so like when Department of Health comes in, we're allowed to give them information as well. So when residents are admitted, we go over HIPAA, we go over the notice of privacy practices, which in basic terms is an attorney's way of making us accountable for not sharing information and not protecting information. And it is basically the do's and don'ts of what you can and cannot do. And they do acknowledge that we go over that. So a few of the rights. They have the right to request restrictions of PHI, patient health information, which means they're allowed to say who can and cannot have their information. They have the right to request alternative forms of communication. When the doctor fills out HIPAA paperwork with you, they always say, can we leave a message? Is it okay to leave a message? That's an alternative form of communication. Here, an alternative form of communication may be calling someone during a care plan meeting instead of having them physically here. The right to access their information, so they do have the right to view it, they have the right to copy it. Again, it doesn't mean that we stop exactly what we're doing and cater to that individual. We have our own jobs that we have to do, so they should make appointments to do that. They have the right to an accounting of disclosures, so they have the right to know who has their patient health information. They have the right to request amendments, amendments of their information. Basically what that is saying is if they see something, maybe they review over their chart and they see that something's not accurate. Maybe they see mom was diagnosed with diabetes and she's never been diagnosed with diabetes ever before. Just because that happens doesn't mean we go through and cross everything out in the chart. We have to look back and see why that occurred, and if it is something that we can change, then we will change. So a breach of confidentiality, that means is what happens if we don't follow the law when it comes to HIPAA. So who is your HIPAA officer here?